Good afternoon, and congratulations to the Geisinger Commonwealth Class of 2020. Yours is a remarkable class graduating at a remarkable time. You chose medicine because you felt called to serve, and that commitment will now be tested. The COVID-19 pandemic is a crisis unprecedented in our lifetimes, a defining moment in the life of this nation. It certainly has disrupted your final months of medical school, as it has for students across the country. You were pulled abruptly from the clinical environment. You were not able to celebrate Match Day in person, the talent show in person, the end-of-the-year picnic, the awards ceremonies, and now commencement. In each case, you have accepted this with resilience, grace, and creativity. Your medical knowledge gives you an appreciation that in the absence yet of demonstrated effective therapies or any vaccine, social distancing is our only tool to contain spread of the virus. So, you have come up with creative and joyful ways to celebrate your match, the end of your year, and this commencement virtually. This gives our faculty and your school yet another reason to be proud of you. In just a few months, this pandemic has claimed more American lives than the 19 years of the Vietnam War. To find a precedent short of war that has had such a broad effect on society, we need to reach back over a century to the influenza epidemic of 1918-19. Many people have used the analogy of war to describe what we're facing now. Wars certainly have disrupted medical education in dramatic ways over the years. For example, during World War II, medical schools accelerated their programs to graduate students in 3 years so that they could be sent more quickly into battle zones. A number of you requested last month to be graduated early so that you could volunteer to join the battle against COVID. Generations of students have had to confront epidemics, but even HIV/AIDS, which medical students in the 1980s first knew as a frightening syndrome that was killing young people that had no name and no known cause. Even HIV/AIDS did not disrupt the lives of every single American as COVID has. In 2020 alone, COVID has infected more Americans than AIDS has over 40 years. And we have no idea when this wave will end or when it will repeat. One thing we do know is that your careers in medicine, starting now, will be different from what we would have envisioned just a few months ago. You are graduating into the profession at a time when trust in our institutions is being seriously challenged. At a time when we need science more than ever, large segments of the population question the fundamental tenets of science. Trust in the independent press, academic expertise, and in our governmental leaders is eroding. But doctors have always enjoyed a high level of respect, consistently second only to nurses in national and international polls. And this pandemic has heightened the heroism and self-sacrifice of doctors, nurses, and other health caregivers. Trust in our profession is now even higher than ever. There are good reasons for this. Doctors are seen as holding the welfare of their patients ahead of their own well-being, as you have now sworn to in your oath. Unlike those who may ignore or bend facts or science to fit other agendas, doctors are seen to have only one agenda, the welfare of their patients. Doctors are seen to take personal risks in service to their patients. Doctors are seen to care. Physicians are invited into the lives of patients as nobody else is. Patients trust us to arrive at the right diagnosis, to administer powerful drugs, to cut them open. They trust us with secrets even their families do not know. This is a great privilege that needs to be earned, and for which you should be grateful. You have earned the degree that we've given you at this ceremony, but the privilege of your patients' trust is something that you will have to earn anew every day. You will earn this trust by caring about them and caring for them as if they were your family. It is caring that guides physicians in making the best decisions, in giving the best care, in putting themselves in harm's way during an epidemic to take care of their patients. It is because doctors and nurses care that they are trusted. And if you really care about your patients, you will discover how much they have to teach you. They will teach you about life and illness and suffering and death and hope. So be worthy of this trust by caring. Let this be your North Star as you embark upon this noble career. If you do, then you will be able to face all the challenges ahead of you, whether it be a global pandemic, a war, the grief of a family member, or the suffering of a single patient. We, the proud faculty of your medical school, are confident that we have prepared you well. Now, it's up to you. Congratulations.